Hey everyone, Dr. Liz here. This is an update after my eye surgery, the vitrectomy and macular pucker surgery. Okay, not the cataract surgeries, which I haven't had in 2018. This is the surgery I had in 2024, and I'm about 8 months out now, almost 9 months. So I had it in February. I'm recording this in October, and just giving you an update. Okay, the main point I want to make here is neuroadaptation. Okay, this is how the ophthalmologist explained it to me actually when I had my cataract surgeries. Our brain starts to adjust and make all these different connections and rewiring after you have eye surgery. So that's why it takes sometimes months after you have eye surgery to really see where your vision is going to be. Now, he told me this so that I knew this and that I didn't give up hope, and probably so I didn't like call his office in a panic. Like a couple of days after the surgery. Actually, I probably saw him a couple of days after the surgery because he did really good follow up. But in general, to let me know, like, okay, your brain's going to adapt. This is going to take months to happen, and you're going to be much better. It's going to be okay, basically. He's a great ophthalmologist, actually, very reassuring, fantastic bedside manner. And I know that's not true of all surgeons or people in general, doctors in general, but he took the time to give me this education, which was very hopeful for me because, particularly after the cataract surgeries, it took me months to get back to regular computer use. I could only use a computer for about, I don't know, 15 minutes or so, that first week or so after that eye surgery. And it took me months to get back to regular use. So, anyway, he explained like it's all the brain. Okay, it's not the eye necessarily, it's the brain making those adaptations. Now, when I had the macular pucker, I actually couldn't see the wavy line. So that's what happens when you have a macular pucker. If you, like for me, it was my right eye. So if I closed my left eye, I could see a wavy line on my right eye, which I thought was very funny, actually. Like, oh my gosh. I had noticed that it had the vision in that eye had deteriorated some, which later I was like, wait a minute, I have implants from the cataract surgery. My vision can't deteriorate in terms of like, how your vision goes worse slowly as you age or something like that's not what's going on. So, at my annual, I said, like, okay, something's going on with the right eye. And they said, okay, that's the macular pucker. It's affecting your vision. And if you close that eye, you can see wavy lines. The reason I couldn't see wavy lines and I didn't notice that is because of my neural adaptation, basically. The left eye took over so much that it accounted for that. Okay, the brain said, oh, it looks like the left eye is going to have to do the work here. And so I made it do the work. It still does that, right? Like when I'm driving or something like that, if I closed my left eye, my right eye vision is not as good as the left eye, and it would be a little bit more blurry. But with both of them open, everything looks pretty much normal to me. So, in terms of the actual specific update for that right eye, the pressure, anytime I tried to come off drops, the pressure has gone back up. But I transferred back to my ophthalmologist who has a more graduated plan than what the surgeon was doing and has like treated this. I don't know, multiple times, not multiple, but like, probably hundreds of times when he gets referred the patient post surgery with the rise in eye pressure. And his success rate is about 90% to get you completely off the drops, which I is like thrilled to hear because this is the ophthalmologist I love anyway. Okay, I was like, yay. I actually like started crying a little bit because I was like, oh, I assumed I'm just going to have to be on the drops the rest of my life. He's like, no, not at all. We're not going to assume that yet. And again, it's like, okay, it's a neural adaptation also that happens, not just for vision in that eye, but also to keep that pressure down, to come off those drops gradually and without like freaking out the eye, basically. Okay. I don't know what other way to say it. He sort of described it like a thermostat. Like sometimes what happens after surgery is a thermostat just sort of freaks out and it can't calibrate properly. So we have to gently encourage that thermostat to recalibrate to keep that pressure down in the eye. So that's what we're doing right now. I'm not off the drops yet, but I do anticipate that I'm going to be completely off of them at some point. And my vision in that eye is it did improve after the surgery. I no longer have the waviness, like I said in the other video. I don't have the floaters at all, which was a huge relief to me because I had some really big floaters that would interfere with my reading sometimes and make it frustrating in that eye. So those all went away. Common question I get, I did not have to stay like face down for a week or two. I don't know why. It just wasn't my case. I guess it's case by case. I never had to do that. But again, there were some other things. I did have to do like all the drops and all that good stuff. So that's the update. Okay. I do want to give you hope that hopefully if you're struggling with this, that your brain continues to adapt like a month's out. I talked to one individual and his doctor told him like, no, your brain's going to adapt and you can improve up to a year out. That's not what I really read in the research. But of course, I don't have access to all the like ophthalmology research. It was just stuff that I had found that there's public access to that said most of your improvement is going to be in those first 3 months or so. But apparently you can improve up to a year after surgery. So that's even better news when I found that out. I was like, yay, but mine's pretty much improved anyway. So I'm happy with that. All right. I'm going to sign off here. Feel free to leave me a comment. I try to read them all. If you are anticipating a surgery and you want hypnosis for that, or have just had surgery and you want hypnosis afterwards to help you heal, I would say up to about a month afterwards, it can be pretty effective to continue that healing process. Then schedule a free consultation with me, reach out to me through my website, my email, whatever you'd like to do. I'm happy to help you with that. I can do that all over the US and a lot of parts of the world too, depending on the time zone, whether we can coordinate that. All right, be well. Peace.